Hello, I'm Dr. John Kruse, and today I'm going to be talking about OCD and ADHD. Are these opposites or what? So there'll be, if you have questions while I'm talking, you can type them in. I'll get to them at the end, or later when this is posted on YouTube or Facebook. If you have questions, I will respond to those posted there as well. So the take home, which I usually start with, is that on the surface, OCD and ADHD appear to be very different conditions, almost opposites in some ways, but we know that they are found together. They are comorbid more often than would be expected, and they do seem to share some brain circuitry underlying them, and actually in some situations they can mimic or resemble one another, or particularly OCD can be mistaken for ADHD. So diving a little bit into what OCD is, so obsessive compulsive disorder means that you have either obsessions or compulsions, or both. We know that about 2 to 3% of adults have OCD full-blown, so this is not a particularly rare condition. It is one, though, that many people are reluctant to talk about. So I've had, over the years, many people who were treated for depression, PTSD, other conditions ADHD, were freely comfortable talking about these other conditions, but had a great deal of shame regarding their OCD and did not bring that up until much, much later in our interactions. So I'll segue into, it's nice, I was just reading this morning that Gabriel Boric, who's the new president of Chile, the 36-year-old who was just elected a few months ago, has publicly talked about his OCD, and some of the symptoms he's shared is when walking, he always had to start with his left foot. So not that that's because he's a leftist. He couldn't leave his bedroom until blinking 4 times. When he missed a word when he was reading, he'd have to go back 2 lines to restart over, which made it very hard to read. So what are obsessions? So obsessions are defined as recurrent, intrusive, disturbing thoughts. So recurrent is they happen over and over again. If it's just one time or one bout, that doesn't qualify for obsession. They have to be intrusive. So it's not just that you're thinking the same thing because you're looking at the same spreadsheet at work. That would be a response to a repetitive stimuli. It's not an intrusive thought. And obsessions are also disturbing. So even, occasionally you can have positive obsessions. You could obsess, puppy love is about obsessing about the one you love, but they're disturbing to the extent, in that case, that they are so excessive that they're interfering with eating, sleeping, or their normal activity. Usually there's something more anxiety-evoking, worrisome about the obsessional thought themselves. And the most common categories for obsessions are contamination, particularly heightened during our recent COVID years, but there's something in the environment, something I ate, something poison, some bacteria, something is contaminating, making me dirty, sick, ill. Connected with that, but separate from it, is obsessions about health or bodily image. So hypochondriasis is an obsession about being healthy. Some of the grooming disorders, obsessions about blemishes on your skin or something like that, or hair pulling can fall into that category. Other common obsessions are about violence, fearing that you will act in a violent way, sex, that obsessional thoughts about sexual activity or behavior, and also more generally about rules and religion, and or that you are doing something that's going to violate some code, some formal set of rules. So our formulation these days is that those obsessives, those recurrent, intrusive, disturbing thoughts, then make someone feel anxious, and as a way to deal with the anxiety, they engage in compulsions, which are repetitive, rigid, and we use the word stereotyped, meaning they happen in the same way over and over again, either thoughts or behaviors to try to counter those. And some of the common, and again, what I mentioned with Gabrielle Boric, so counting, tapping, washing, cleaning things, counting, ordering, the person who has to rearrange their spice cabinet in alphabetical order, hoarding are also compulsive behaviors designed to attempt to ameliorate the anxiety, which don't often have that positive effect. I'll say just one very brief aside that's separate from OCD or obsessive compulsive disorder. We do recognize a condition called obsessive personality disorder, where you actually don't even need to necessarily have obsessions and compulsions, but it's more that you have a personal style of everything has to be perfectionistic, done to your specifications, and if it's not, then there's great distress and avoidance of interaction with the world. So on the surface again, the OCD is at one end of what we used to think of or formulate as an compulsive, impulsive spectrum. So the compulsive OCD person does things in a rigid way. They are risk averse. They're afraid of the world, afraid of breaking rules. Risk averse, rigid, repetitive, compulsive versus, again, ADD is often looked at the other end of the spectrum, where people are impulsive, externalizing, responding to things in the external world excessively, and having trouble with delayed gratification and often risk-seeking. So again, that internalized, focused on what's going inside. And at the medication or treatment level, there seem to be substantial differences. So OCD, for years, there's a huge body of research that serotonin reuptake inhibitors are the drugs of choice and often help substantially with symptoms. Whereas with ADHD, serotonin's medications on the whole don't seem to be effective particularly, and it's the stimulants which are affecting norepinephrine and dopamine and other non-stimulants affecting those neurotransmitters. So it looks like these are two completely different things, but then when we look, they are found much more commonly together than one would expect. So both OCD and ADD most commonly arise in childhood. ADD, the official definition is that it always arises in childhood. Maybe about a third of kids with ADD outgrow it by young adulthood, and the other 2/3 either have full-fledged ADHD or some lesser degree of it throughout their life. With OCD, there's a big peak in childhood, a secondary peak in early adulthood. But about half of the kids or more who have OCD do outgrow that before they become adults. So there's not necessarily a need to panic or worry that if your child is showing OCD symptoms, because again, a large proportion of those kids, almost approximately half, will outgrow that, by adulthood anyway. So jumping back to the statistics of people with OCD, of kids with OCD, a full fifth of them, 20%, seem to fully meet ADHD criteria, and at least 8% of adults with OCD meet ADHD criteria. That's both of those numbers about twice what we would expect just from random frequency of ADHD in the general population. And then conversely, looking in the ADHD population, some experts say as many as 30% of people have some OCD symptoms, not necessarily full OCD spectrum, and there is a lot of variability in the numbers, so these are sort of overall consensus Gestalt numbers that I'm pulling at. But again, if you have OCD, you're more likely to have ADHD. If you have ADHD, you're more likely to have OCD, so there's clearly some overlap or confusion between them. And that will segue into areas where OCD can awfully confuse. Someone with OCD, particularly a child, can be mistaken for having ADHD. So some OCD symptoms I mean, if you are so absorbed in your internal obsessions, if you're thinking God's telling you bad if I speak up, or if I look sideways at the people next to me, something horrible is going to happen, or you're just distracted. It doesn't even have to be an action inhibiting action or obsession, but obsessions themselves, if you're that focused on what's going on inside your brain, you are likely to be inattentive to the teacher calling on you or your friend asking you a question during class. So obsessions themselves, or engagement in compulsions, if you're busy tapping your fingers because you know that will make the evil spirit go away, or make the teacher give you an A, or whatever it is. If your attention is absorbed either with your obsessions or compulsions, you may well be inattentive to the outside world, and that may look like ADD inattentive to someone who isn't searching out the origin for why you are inattentive. Similarly, OCD can lead to great procrastination. I've had patients who, because I had to comb their hair, yes, most of them did have more hair than I did, but that it took them literally an hour to have each hair aligned in place, exactly aligned, they would chronically show up late for appointments with me or in the real world, or be late to work. That would be different than the typical ADD being late, because it's not that you're spending an hour just on your hair, it's that you might start combing your hair and then remember, oh, I still have 2 minutes, I can go floss my teeth, and then I can still check my email because I have time. So it can, again, look like tardiness, missing deadlines because of poor time management. Again, with questioning, usually you can elicit whether this is because of obsessive compulsions or obsessions or compulsions, or whether it's because of poor time management and distractibility with OCD. And related to that, not just poor time management, but OCD can lead to procrastination. If you know that you have to appear a certain way before you go outside, you may put off going outside because it will take you so long to prepare to do it, and avoidance of that can lead to procrastination. Also, in the motor realm, some OCD compulsions do involve, again, finger touching, sometimes tapping, and again, that can resemble the fidgetiness, the hyperactivity that's a component of ADHD. So it's important in sorting things out, not just to look at the behavior and think you know why it's going on, but ask the person, why are you so restless or moving your hands so much? Why are you, late for this interaction? Why weren't you responsive when I was calling to you earlier? So the origin of different behavioral symptoms is important to sort out in terms of determining whether someone really has OCD or ADHD, but again, they can have both going on. So how can or why might they have both going on? So this is going to oversimplify some of what I've talked about in other talks. But a consistent finding in brain research is for ADHD that there is hypoactivation of executive function circuitry, that frontoparietal, basal ganglion, maybe cerebellum as well, system that organizes attention, organizes time management, helps with response inhibition, so you're not as impulsive. So there's underactivation. One of the most consistent findings in neuroanatomy behind ADHD is shrinkage in the smaller basal ganglia, particularly the caudate nucleus. Those are the same circuits that the frontoparietal executive function circuit that's implicated most strongly in OCD. With OCD, it tends to be the opposite, that there seems to be overactivation of that system, and one of the more consistent neuroanatomic findings is larger than average basal ganglia, particularly the caudate nucleus. So again, why might there be overlap between these two when it seems one's going up on the system and one's inactivation of the system? And there's one model for OCD that's thought of, an overload on the executive function network, that part of where what's going on in OCD is the claim that someone's getting so much stimuli that's overwhelming these obsessive thoughts, that is short-circuiting effective executive functioning, and rather than, again, finding more adaptive solutions to their problems, they're resorting to a less good, repetitive, compulsive stimuli, or compulsive response to that stimuli. Another thing to remember, and many of the findings with ADHD and executive function deficits or activation of certain processes are task-dependent things. So ADHD is not attention deficit. It's problems with control over attention. And then again, understanding that, seeing that, helps understand why there could be similarities between OCD. That OCD in some ways is not being able to resist attention to these internal thoughts that are coming your way, telling you that you can't go outside if you have a spot on your shirt, or that you might be contaminated by some disease, or X, Y, or Z, that these thoughts are so hard to resist. Again, that you can't not pay attention to them. So again, the control of attention being the problem rather than attention per se, again, links these two conditions more than makes them diverse. On a genetic level, so increasingly, for years we were looking at specific genes, particularly dopamine genes contributing to ADHD, or serotonin genes contributing to depression or OCD. And although there may be a small handful of genes which slightly increase the risk of it, it's clearly not the case that you have some dopamine transporter wrong variant and therefore you're going to develop ADHD. Both of these conditions have strong genetic components. The evidence is stronger for ADHD, or that it is a larger presence for ADHD than for OCD, but prominent in both. But that for both conditions, it's hundreds, if not thousands, of different genes where having one variant of that gene is slightly increasing, slightly, way less than 1%. And it's the aggregate of all these different variants of these genes together which are increasing your propensity to have these conditions. So as almost everything else in mental health, it's always nature and nurture. It's not that genes determine it. It's not that genes are irrelevant. It's that they are increasing propensities, making the likelihood greater given certain environmental and situational stimuli that these conditions will be evoked. So again, we haven't identified specific individual genes, but specific individual genes don't play a large part in either ADHD or OCD. Again, it's a collective input from hundreds, if not thousands, of genes. So the other, jumping back to the medication front, so with OCD, again, I said the serotonin reuptake inhibitors are overwhelmingly the first choice. Unlike with depression, where we fairly frequently get complete resolution of depression, not always, but it's a reasonable goal, with OCD, although a handful of people get complete resolution, it's more often that we're reducing the severity or making it easier to resist the symptoms. And one of the things that's been found in the last 2 decades that added onto serotonin reuptake inhibitors often improves the results is adding a dopamine blocking agent like an antipsychotic. So that's the most commonly used and most established augmenting strategy. And again, it's suggesting that rather than these greatly distinct entities, there may be more overlap between OCD and ADHD than we would appreciate on the surface. Interestingly, for some people, and this is more anecdotally reported in case reports, that rather than a systemic studies. Sometimes adding stimulants to SSRIs for OCD can exacerbate or worsen. And particularly I've seen people who developed or who had worsening of nail biting or other compulsions when stimulants were added to their OCD regimen. On the other hand, I've seen people with lifelong nail biting patterns who noted a complete resolution when a stimulant was added. So that area hasn't been studied extensively. There's clearly lots of individual variation. So I'll just again wrap it up that although on the surface it may look like people with OCD are internally focused, risk-averse, rigid, repetitive, and completely unlike a spontaneous, externally oriented, risk-embracing person with ADHD, there do seem to be overlaps in terms of problems with how the executive function systems are regulating inputs and the flexibility in responding to inputs and the difficulty in inhibiting or turning off signals that may not be salient to the task you really want to be engaged in. So I'm not seeing any questions popping up. I'll be back in 2 weeks, not in 1 week. I'm switching to an every other week format, and the topic then will be gamma oscillations and attention. What in the world does that mean? Stay tuned. That's all. Have a healthy, happy week. Bye.